The doctor becomes the patient to give us a close-up look at a 30-minute test that can save your life.
Our chief health editor, Dr. Partha Nandi, is getting a colonoscopy. He's got a camera, he's using no anesthesia, and a quick warning about some of the graphic pictures you're going to see because you will be looking inside Dr. Nandi's colon as his doctor searches for possible polyps.
All right, Dr. Nandi, you're the practitioner, gastroenterologist, so you're an expert in this field here, but now you're on the other end of it.
And a brave soul.
That's right. I can look at my own colon, so I can tell you all about it. You know, one of the things that I tell everyone is colon cancer is the third leading cause of cancer death, but it can be prevented. I recently learned that I needed a colonoscopy for symptoms that I had. Well, this happens to be Colon Cancer Awareness Month, so I thought it would be a great time to share my experience with you. And I did it without any sedation to prove to you there's really nothing to fear. Colonoscopy, the 11-letter word that makes everyone cringe. It's crucial for people 50 years of age or older. I'm a few years from 50, but blood in my stool caused me to get tested. I thought, why not show folks out there, you know, what we go through the eyes of a doctor as a patient. The first step, beginning to clean out my colon, starting with clear liquids the day before the procedure.
So it's about 3 o'clock in the afternoon, and I've been seeing patients all day, and it's time for the first part of my preparation, which is taking 2 of these Ducalax tablets, and they're laxative tablets, and what they do is they get me ready for the preparation for tonight. I'm taking that with my most favorite Welch grape juice, white grape juice, and I will go back to see patients. Hopefully I don't have to leave the room rapidly as the prep takes effect.
Part 2, fun with the family. And I'm drinking this wonderful concoction of Gatorade and Miralax as I look forward to a long night in the bathroom. Cheers! Awesome. This doesn't taste that bad. So, you know, here's the thing, we're kind of having fun with it, but the important thing is that we need to make sure we have a good prep and so that the doctor can see everything to prevent colon cancer. So here's bottoms up. Finally, the day of reckoning arrives.
We just do a rectal exam and feel the prostate too. Everything feels normal.
Dr. Emin Donat begins examining the inner lining of my large intestine.
Now this is the twistiest part of the colon called the sigmoid. This is supposed to be the most uncomfortable. Again, I'm not sedated and I'm doing fine. Imagine if you're sedated, this is a piece of cake.
Polyps look like little mushroom-like growths that come off this nice pink-looking surface.
And so those little polyps he's talking about, if you take those out, that can prevent you from having colon cancer. So we think the vast majority of those colon cancers come from polyps, so that's why he's looking for those. You can also see diverticulosis, which are little pockets of air. I don't see any there as well, so it's good.
So far his colon looks great.
You have not seen any of my wife's shoes in there yet, have you?
No, not yet. It's probably higher up.
Sometimes, yeah, it's probably higher up. It's probably embedded in there.
And the results?
That little dimple right there, that's the opening of the appendix, so that's the furthest part of the colon that we need to get to.
That's the promised land. We're at the end.
Woohoo! Time to celebrate. So your colon still looks perfectly healthy on the way out too, Dr. Nandi.
Great.
I don't see any abnormality.
Well, great. So you guys witnessed me having a colonoscopy here. So again, very simple. I had no sedation. It was easy. So I encourage all of you who need to have it done, please have it done. Not a big deal at all. This is a 10 or 15 minute procedure that can really save your life, and you can see if I can do it, you definitely can do it. Honestly, I was a little bit nervous, but remember, I was comfortable throughout the entire procedure without sedation, something that you'll never be doing. You'll be getting sedation. So if you get a colonoscopy and you're taking medications, check with your doctor because you still need to take your blood pressure and cardiac meds, especially when you're taking anesthesia. Keep in mind, a colonoscopy is successful 94% of the time in detecting colon polyps and cancer, so really good. And if your doctor finds something, it can be easily treatable. Now, while most people have it done at age 50, African Americans are at increased risk, so they should get it at age 45. If you have a family history, you may be even needing it earlier age. So I challenge all of you in Metro Detroit to get screened at the appropriate time. Together, we can stop a killer.
So, Doc, here you are. You're laying there. You got a mic on. You're smiling, talking. I mean, was it really that comfortable?
You know, here's the thing. You know, I do this every day, so I know what to expect. If you take the average person, put them in the seat that you're in, no way they could pull off what you do every day. So I know what to expect. So I tell you, I just did it to show you that, listen, if I can do it, you can do it. And people say, why did you do it, you know, with the cameras? Because I wanted to show people that you can do it. And if we can save one life, totally worth it. Colon cancer is completely treatable in my opinion. Let's go out there and get screened, okay?
All right. You got it. Thank you.
Thank you.
Dr. Nandi. Let's go to Dr. Rexroth right now, who's doing a close
Hey,
examination
listen,
of the skies.
doctor, don't leave. I'm 50, all right? I'm going to go get mine soon. How often do you have to do a colonoscopy? Just the one time?
At one time, and if you have polyps, then you may have to do it in 5 years or 3 years, depending on the polyp.
There you go. All right, that's what I wanted to know. Thank you very much for that.
All right.
All right.